What is a stroke? A stroke occurs when a blood vessel is either blocked or ruptures. This prevents oxygen from traveling to certain parts of the brain, resulting in dying brain cells. When a blood vessel is blocked, it's called an ischemic stroke, and when a blood vessel ruptures, it's called a hemorrhagic stroke. There are also many strokes called a transient ischemic attack, TIA, that cause temporary clots within the blood vessels. What are common signs and symptoms of a stroke? The first step in getting treatment for stroke quickly is recognizing the warning signs. Balance. Check for the sudden loss of balance and dizziness. Eyes. Ask if vision is lost or unclear. Face. Look for an uneven smile. Arm. Check if one arm is weak. Speech. Listen for slurred speech. Time. Call 911 right away if you or someone else has any of these symptoms. What types of testing are done to diagnose strokes? A physical exam, blood tests, magnetic resonance imaging MRI, and computerized tomography CT scans, carotid ultrasound, and an echocardiogram are done to help diagnose strokes. These are all necessary for receiving an accurate diagnosis to determine next steps. If you have a stroke, what are the treatment options? If you or a loved one has signs or symptoms of a stroke, it's important to get emergency care right away by calling 911. All strokes require emergency treatments, but the care is different for an ischemic stroke or a hemorrhagic stroke. An ischemic stroke requires a quick restoration of blood flow to the brain. Emergency care for a hemorrhagic stroke focuses on controlling the internal bleeding and reducing the pressure from excess fluids. In both cases, patients must meet certain criteria and need to seek care quickly after symptoms begin. Specialists at Ascension sites of care deliver advanced stroke care, including surgical and therapeutic care. Where can you get stroke care for yourself or loved ones in Indiana? The first step in getting treatment for stroke quickly is recognizing the warning signs and then calling 911 or seeking emergency care. Signs of a stroke include sudden loss of balance, lost or unclear vision, face drooping or uneven smile, arm weakness, and difficulty speaking. Ascension St. Vincent, Indianapolis has earned the designation of Comprehensive Stroke Center by the Joint Commission, meeting rigorous standards in providing advanced imaging and treatments for complex strokes. Our doctors specialize in treating various types of strokes, including hemorrhagic and transient ischemic attacks, TIA. We quickly work together to help improve blood flow to the brain, stop a brain bleed, and help prevent future strokes. Our highly specialized stroke care helps support better outcomes at a time when you need it most. And our care teams can also connect you to our advanced stroke specialist for personalized follow-up care, including rehabilitation. If you or a loved one are experiencing warning signs of a stroke, sudden loss of balance, lost or unclear vision, face drooping or uneven smile, arm weakness and speech difficulty, every second counts. Call 911 and go to the nearest ER.